to bring in clinicians from the hospital and patients themselves to connect with each other, with developers, to see what's new in the market, and ideally to innovate and test in a small way a real-life product, something new. Recently I've been testing Fitbit, which is a wearable device. It's this thing on my wrist here. It's got a sensor inside, like a pedometer, an accelerometer, and it tracks my steps, it tracks my sleep, and I put in my calories, and it tracks my weight. Using all of this together, plus gamification techniques and support from my crowd, I've lost 25% of my weight in 8 months. I knew I was overweight, so I was 95 kilograms, but actually I didn't know I was that heavy, because we have this sense of ourselves that we're not that bad. So the first step was quantifying myself. So there's a movement called Quantified Self, which is about measuring things. It could be your footsteps or your water or your alcohol or calories. So just knowing helps. Secondly, the application. I could track how far I was walking, and I had a target to walk 10,000 steps a day, which I couldn't believe that you had to do that. So that's an hour and 40 minutes a day walking, 5 miles a day. So having some set targets motivated me to get to the target once I'd realised it was possible, once I'd checked it on Google. And then getting rewards. So by achieving targets, you get little badges, say well done, you've walked 10,000 steps a day, 15,000, 20,000. And it tells you how far you've walked in your lifetime, and different little badges like that give you a moment's positive feeling. I think the crowd is really important. So the people around me, so I've influenced a number, people have chosen to follow and buy one of these things themselves, and they give me a little nudge. They might, some people cheer me if I do a good walk, or if I don't walk much one day, they'll jeer me. Nick, my friend, who we met on Twitter, he'll tease me and say, "Get up off the sofa, you haven't walked today." So we'd go out walking at 11 o'clock at night in the rain with umbrellas in order to hit that target and compete with each other. So there's a leaderboard that shows how many footsteps each person's taken in the week, and we compete to be at the top. I think that it's important that we apply this widely with the public, with citizens, so that all clinicians could prescribe it, because we need to move from treating people to preventing ill health. We need to keep people healthy. Most conditions now are long-term conditions like diabetes and heart failure and asthma, and people need to look after themselves and change their behaviours. So gamification and using apps and things like this can make a difference. What's interesting is that there is a massive growth in this field of wearable technology and health technology, so that people are getting on and doing it themselves. So whilst the doctors are saying, well, where's the evidence, and waiting, people are actually going out there and using Runkeeper and Calorie Count and a whole load of apps themselves. So I think almost the NHS needs to catch up with what people are already doing. I think there's a lack of understanding. There's a great deal of pressure in the NHS as well. So as the money's getting tighter, people are focused on efficiency savings, doing more with less. And there's still a limited understanding of systems, and so people are still focused on the patient that's collapsed in front of them and they have to give really good care to right there and then, as opposed to stepping back and understanding the patient journey and the pathway and how we can work differently with patients and co-produce new ways of working. So I think that we need to find the time and space to step back and try and reimagine how healthcare can be. I think that things can be promoted through social media. I think that that's quite a powerful mechanism. This can be supported through campaigns. So, for example, NHS Change Day was a big campaign in the NHS. There are different local ones. There's also the innovation challenges, different technology funds that could potentially be used. Different groups could come together as part of a research project possibly. So I think we need to come together in different ways through networks and publish the benefits and celebrate success. I think we could work better with the companies, and certainly I made a lot of effort to connect with one or two companies, and some are more responsive than others. But I think that this is definitely coming and will make a big difference to patients. We're coming to a social era now, and it's going to be very different from the previous models of how the world worked. I believe it's going to be bottom up, so that the citizen will be powerful and it will be based on data. So people say widely data will be more valuable than oil, so everyone will be trying to capture data. I've got a friend who suggests that people should charge companies to use their own personal data. We will, in time, become more aware of the benefits of this data about us. So, for example, we're quite happy to go to Amazon, and with them knowing our data, they make recommendations of a new movie or book we'd like. And the more they look at our data, the better those predictions are. So we get a lot of data tracked on us from the DVLA, from insurance companies, on CCTV, Tesco club cards. So we are not yet aware of that. Over the next few years, some things like care.data will make this much more visible to us, and we'll have a debate about that. And in time, we will embrace a transparent collection and sharing of data. We're just at the beginning of this, but they will, organisations will track, and we will share our personal outcomes data, the cost of all the activity around our healthcare, and this will be aggregated up, which will give us much better transparent understanding of, do medicines work, do interventions work, where are the gaps. It will enable new gaps in the market to be made visible, so that new companies can come in and innovate, and it will be aggregated and help us understanding population health much better. It's going to be transformational. I think the technology will change so that this becomes just normal. So kids today don't think of iPhone or laptop as technology, it's just like breathing. And the technology becomes so seamless so that I will no longer have a thing I wear on my wrist that I need to charge. It'll just be part of my clothing or in the room. The sensors will just be everywhere, and it will become much more easy. I won't have to type in that I've eaten a tuna sandwich for lunch. It'll just know. Everyone's talking about Apple bring out an iWatch that can tell your glucose just through the skin. So it will become easier. And a lot of older people have long-term conditions, but if my parents were infirm, I would be making some decisions on their behalf, and so I'll be pushing for this.